Hello, this is Tony Heller from RealClimateScience.com, setting the record straight about viral epidemics. 10 years ago, there was an article in Forbes magazine, Why the World Health Organization Faked a Pandemic. The agency needed to bounce back after the avian flu embarrassment. It was charged that the agency deliberately fomented swine flu hysteria. And then the article went on to say that an estimated 250,000 to 500,000 people die from flu every single year, and that the mildest pandemics of the 20th century killed at least 1 million people. COVID-19 has just passed an official 1 million deaths. So COVID-19 has now reached the level of a mild pandemic. The 1918-1919 flu pandemic killed 50 million people, and the world's population was much smaller then. The death rate from that pandemic was 300 times higher than the current pandemic, and the average age of death in 1919 was 28 years old, compared to 80 years old with COVID-19. According to the New York Times, 2 years ago more than 80,000 Americans died from the flu. And that was with a vaccine available, which most Americans had received. Lots of hospitals were overwhelmed with flu patients at that time, but very few people in the country would have even been aware of the fact that we were having an epidemic. And flu tends to be much deadlier to young people than COVID-19 is. The COVID-19 data out of Italy during March showed that the average age of death was about 80 years old and that 99% of those who died had multiple comorbidities. So most of the people who died probably would have died in the next year or two under any circumstances, even if they weren't infected with COVID-19. Italy, like many U.S. states run by Democratic governors, sent sick people into nursing homes and killed lots of people. According to the London School of Economics, between 42% and 57% of deaths in Italy, France, Ireland, Spain, and Belgium occurred in nursing homes. In Italy, people called it the silent massacre of the elderly. You can kill a lot of people in nursing homes by infecting it with almost any disease, because people in nursing homes are extremely vulnerable to disease. Governor Cuomo of New York sent thousands of sick people into nursing homes and created the highest death rate in the world. Nobody should be surprised by what happened. COVID-19 has now killed 0.01% of the world's population. In this pie chart, that slice is just barely visible. Compare that to the Justinian plague during the 8th century, which killed half of the world's population. I'm going to finish this up with one more pie chart showing U.S. COVID-19 deaths versus the number of people who died in the United States while Barack Obama was president. 99 times as many people died while Obama was president as have died from COVID-19, yet the press didn't get hysterical about that. When you have an extremely large population of people like the United States has, a lot of people are going to die. About 9,000 people die in the U.S. every single day. Most of the population does not have a good understanding of proportion, mathematics, or statistics, so it's very easy to manipulate them through fear and propaganda. Toto, on the other hand, is a pretty smart dog. You can visit him and Kyrie on the web at realclimatescience.com.